Good morning, everybody. It's my pleasure this morning to introduce a longtime colleague and friend, Dr. Astrid Pujari. Astrid is going to talk today about the gut microbiome. And thinking back, I think we did have this talk some time ago with Dr. Ian Gann, and it was so long ago that I think Morris has culled our file in the Grand Rounds archive. But it's interesting when you think about that, because in medicine, we all know that things come out and they're kind of the hot topic for a while, and they cause everything, and they help everything, and they cure everything, and they're related to everything. And then gradually they change and become more scientific. And I'm really interested to listen to Astrid today because it's been quite a while since we had it. Dr. Pujari trained, originally went to medical school at Tufts and then did her internal medicine training at Scripps in La Jolla. And that's a big thing, because what Astrid brings to us in our integrative medicine department at Virginia Mason is a great knowledge of integrative medicine and some alternative or holistic or whatever word you want to use. But in her heart, she's also a scientist. And that really helps us in these discussions. She also got her certification in medical herbology at the Royal College of Phytotherapy in England. And she's been with us for many years, and she's going to help us through this and tell us what's going on with the microbiome and how it relates to our practices today. Thanks, Dr. Pujari.
Thank you so much for being here. I'm really grateful to be here, and thanks for joining on Zoom and wherever you are in your homes. So, as Dr. Nietzsche was sharing, we're going to talk about the gut microbiome and your health, and kind of a little bit about the state of the research, which is still developing quite a bit. So basically, the Human Microbiome Project says that the human body has about 100 trillion life forms in it. And it includes not only bacteria, but viruses, fungi, parasites, protozoa. So even though a lot of times we think about bacteria as being the main organism because it's what we've studied more, actually viruses may be more predominant, and they're still looking into that. Even though we're focusing today on the gut microbiome, I just wanted to remind us all that the microbiome really is in the skin, the oral pharynx, the respiratory tract, and the genitourinary tract as well. So when we're in the womb, we actually are pretty much in a sterile environment. So it's kind of amazing because by the first year of life, we have about 70% of our microbiome developed. And by the age of 3, it's actually very stable. And so it's kind of remarkable because we almost go from nothing to 70% to full development within 3 years. So how does that happen? Well, as you might expect, how we're delivered makes a big difference. So with vaginal delivery, for example, Enterobacteriaceae set up colonization, which actually helps the development of bifidobacteria. And with C-section, though, the flora we're colonized with are very different. So it'll be hospital and skin flora versus the mother's flora. And that can really sort of set up a very different microbiome actually even for life. So with C-section, we all know this, but as a review, there's higher rates of asthma, allergies, and eczema. There's also higher rates of food allergies, celiac disease, obesity, type 1 diabetes with a 19% increase. And what we know from studies is that the microbiome is different for at least 7 years after the child's delivered. It may be actually for much longer than that, but that's as long as the longest study has gone. So of course, this isn't proven to be cause and effect, but there's a plausible mechanism of action based on these studies that I put here, including from the New England Journal. So after we're delivered, then the next step is how we're fed, right? So if we're fed breast milk versus we're fed formula, again, it really changes our microbiome. So as it turns out, I find this fascinating that our third most common ingredient in human milk is actually not even digested by the baby. It's there to actually feed the bifidobacteria in the gut. So these are human milk oligosaccharides. And lactobacilli actually love lactose, so that's in human milk as well. Now, lactose will also be in formula, but you're not going to get the human milk oligosaccharides. Interestingly, I didn't put this in the talk, but just if you look at studies, our bifidobacteria tend to drop as we age, and Clostridia, as people get older, increase. And that actually may be in some epidemiologic studies a marker for health. So it's really interesting that you're seeing a lot of the things that, so vaginal delivery, human milk oligosaccharides actually help promote those bifidobacteria. There's a 20% higher survival rate in breastfed infants versus formula fed. Again, this isn't proving cause and effect, but there's a plausible mechanism of action. So after delivery, then we have how we are fed, and then we have sort of our environment. So we know, for example, children that have pets, that are on farms, that go to daycare, have much lower rates of asthma, allergy, and eczema than other children do. So that brings up the question, well, what constitutes a healthy microbiome? And as it turns out, we're still working to define that. So there's a lot of interpersonal, intercultural variability with that. One place that research tends to agree, and there's, again, it's sort of like studying a forest. So it's very hard to agree on many things about what's healthy in the microbiome because of the individual and intercultural diversities I shared. But one place researchers do agree is that a diverse microbiome is definitely a marker for health. So lack of diversity actually correlates with many chronic diseases. And I've listed some of them here, not all of them, because it would be a very long list. But for example, inflammatory bowel disease, diabetes, obesity, all correlate with the drop in diversity. So does multiple sclerosis, a number of autoimmune diseases, et cetera. I really enjoyed this article. This one is from the American Society of Microbiology in 2019, and it's titled "The Disappearance of the Human Microbiota: How We May Be Losing Our Oldest Allies." And as it turns out, that those cultures that are closer to ancestral cultures, such as in the Amazon, the Malawi, in Tanzania, have a much bigger diversity of microbiomes compared to that of Western societies. And the point that they make in this article is that human microbiome that we've co-evolved with over millennia are actually disappearing. Many of those taxa or species are dropping in our microbiome. And then they make the argument that it may explain the rapid rise in non-communicable diseases in Western society. I would actually also argue that it may also correlate with a rise in communicable diseases. Because it really, we know about the microbiome as it affects the immune system, which we'll go into in a moment. So this is a fascinating study that I really like because it follows people over multiple generations. And we're trying to answer here the question of, well, why is there a drop in diversity in Western society? What's contributing to that? So this study basically took people from Southeast Asia, and what they were doing is they were moving to the US. So what they noticed in that first generation is within months of moving from Southeast Asia to the US, they lost 15% of their microbiome right off the bat. And this was thought to be related to change in diet, but it may be related to other factors that we don't know about. So we do know in the Western diet, there's higher fat, higher sugar, and loss of fiber, which I talk to people about all day long. So that's definitely a factor. In addition, what I found really fascinating, though, is if those folks actually developed obesity in that first generation, they actually dropped their microbiome another 10%. So within that first move, they could get a drop of 25% in their microbiome diversity. Then with each subsequent generation, they got another 10% drop, another 10% drop in diversity. This actually fits with what we see in mouse models. So if you can see here in that first top column, so there's a mouse on a high fiber diet. If that mouse transitions to a low fiber diet, it's going to get a drop in diversity. So you can see that in the picture. If that mouse now gives birth to a baby, that you're going to get an even bigger drop in diversity with each subsequent generation on the same diet. If the mouse on the top row transitions back to high fiber diet, you still lose some diversity from that, and you'll still get some drop with subsequent generations. And if they don't maintain that healthier diet, they're going to get a drop in diversity. So this really fits, the two studies kind of correlate with each other. So let's talk about, in Western society and in general, what contributes to diversity drop of our microbiome. So sanitized lifestyle, not shockingly, all of the hand sanitizer we've been using in the past 3 years probably has helped. Antimicrobial washes, antibiotics. You know, a lot of patients, I will say, a lot of patients don't know that a lot of our antibiotic exposure doesn't even just come from, you know, going to the doctor, but actually comes from our meat and our milk, because animals that we eat actually get way more antibiotics than even humans do with the way we're farming. Pesticides, less farming and dirt, dishwashers, clothes washers. People don't, again, patients don't always realize, but when they use the powders and, you know, just clothes washing, it alkalinizes the water, and so it'll actually change the skin microbiome. And medications, this we're very familiar with. So for example, a proton pump inhibitor, we all know, you know, promotes gram-negative bacterial pneumonia. Why is that? Because of the inhibition of the microbiome. And interestingly, there's lots of meds that change it. So antihistamines, I was just reading a study yesterday on this, that antihistamines change it, etc. Things that we might not expect. We also know that our diet is very poor in the West. So high in fat, sugar, and meat, and less in plants and fiber. That makes a big difference. This I found fascinating, is that 75% of the world's food is just from only 12 plants and 5 animal species at this point. So we've really dropped our diversity in our food. And this is also supported by a different study I didn't put here, but by the UN that's looked at this. So this brings up, well, what is our fiber goal? If fiber is really important for the microbiome, what's our fiber goal? And I really enjoyed this study. It's called colloquially, the African diet swap. So as background, the rate of colon cancer is 16 times higher in African Americans than in rural South Africans. And what we know is that in the West, we have a transit time for our stool of about 12, or forgive me, in the West, our transit time is about 48 to 72 hours, but in rural South Africa, it's about 12 to 24. So almost half at least in terms of transit time. So this study, even though it's small, I thought was really well done. What they did is they took 20 patients who were African American from Pittsburgh and 20 patients from rural South Africa, and they actually had them switch diets for 2 weeks. And they actually placed them in a house. So they monitored everything they did. They couldn't eat anything besides what was given to them. So as background on the African diet, just I want you to notice, and I put it in red here, is that their protein on the African diet was almost 66% plants. And look at their fiber, it's around 66 grams. And the fat is much lower. So it's about half, so 16%, versus a lot more fat on the American diet, a lot more animal, and a lot less fiber at 14 grams, which is 14 grams is even slightly higher. Sometimes we'll say, you know, Americans are eating around 12. So on the rural African diet, what they saw, even in just 2 weeks, which I find remarkable, 250% increase in butyrate. And butyrate's a short chain fatty acid that basically is generated when bacteria ferment that fiber. And as background, it's the preferred nutrient for the colon. So it's actually food for the colon. It increases cell differentiation and apoptosis of colon cancer cells. And it's also anti-inflammatory and antioxidant. That's why in the past we've used like butyrate enemas, for example, for ulcerative colitis, right? So it also helps maintain intestinal barrier integrity. So we'll talk about that in a little more detail later. On the Pittsburgh diet, the butyrate dropped by 50%. And there was an increase in inflammatory markers in the stool, and also an increase in secondary bile acids. Just remember that secondary bile acids are actually used as tumor promoters in experiments. So the question that I wonder to myself, and I have for a while, is, and again, this is not proof of cause and effect, but should our fiber goal be set higher? Right now, the US government sets it around, depending on the person, 30 grams per day is the goal. But if you look at all these ancestral diets, as I've shared with you from the earlier studies, that on average, they're eating at least 60 grams a day and often 100 grams per day of fiber. So it's a very different scenario. So mechanisms of action, how does the microbiome affect our health? So these are, what I will say is that in terms of the immune system, the microbiome clearly has a lot of data showing that it really does affect the immune system and help it. So the microbiome is very important for mucosal barrier integrity and repair in the intestines. It also supports anti-pathogen defenses. And interestingly, those defenses are not just in the GI tract, it's also in the respiratory tract and even in the brain, which I want to spend a little bit of time in a moment talking about. Probiotics actually improve antibody response to vaccination. So I've read a few studies where if you give probiotic to an older adult, it actually improves their response to, for example, antibody response to the flu shot. And it's very important for the development and function of immunity. So what we know, for example, is that the microbiome is very important for the B cells to generate secretory IgA. But again, I didn't put this study in this talk, but it also is important for the secretion of all antibodies, so immunoglobulins in general. It's also very important for regulation of the immune system. So probiotics actually help develop T regulatory cells and T17 cells. And both of those actually help balance the immune system so there's not overreaction or underreaction. It's very important, as we know. So this is just a pictorial example of these same points and just done a little bit differently. So if you look in the green there, that's the commensal bacteria, that's your healthy microbiome. And you can see here that your healthy microbiome generates the secretion of microcins and also stimulates the epithelium to secrete defensins. Both of those kill pathogens. It also stimulates mucus formation from the epithelium. And as I was sharing, it actually, in eating the fiber, generates short chain fatty acids. The number one we'll focus on in the talk today is butyrate. Butyrate actually, again, promotes circulation in the intestine, and so it helps develop that apoptosis of colon cancer cells. It also, because it's an acid, it's going to lower the pH of the stool. So that actually helps with reduction of, let's say, calcium, magnesium, zinc, et cetera, which then promotes absorption by the gut. So it could actually be important, let's say, for bone health. And that lowering the pH then helps kill pathogens as well. And we'll see that like in the vagina too. Lowering that pH helps to prevent, let's say, bacterial vaginosis. Butyrate is also really important for nutrition of the colon and increases tight junctions. So we don't want, as you know, we don't want spaces between our GI cells to be too big, because then things can go through, and so it improves that tight junction. I'll just give you the analogy for a moment that I give my patients a fair amount with that, and sort of rationale of why fiber is important and why eating plant foods is important. So this is a bit graphic, but I think it's accurate also, is if you imagine sewer water, which, I mean, the microbiome is healthy, but it's also kind of like sewer water. And you put your hand in, okay, and you've got big, thick gloves on. That's one experience. And if you put your hand in and it's got cuts on it, it'll be a very different experience, right? In the second scenario, you're going to end up probably with sepsis. And but with the gloves on, you know, good fences make good neighbors. So why I say that is because we want to have a healthy, this goes back to the point that the microbiome helps maintain a healthy fence, a healthy barrier between us and actually what is like a soup of bacteria, right? So we really want to have that healthy microbiome and that healthy intestinal lining. And butyrate and fiber are very important for that, as is the microbiome. In addition, what we know is that, as I shared with you, the commensal bacteria stimulate T regulatory cells and T17 cells, which help to regulate and balance the immune system so it's not over or under responding. So I'd like to take a moment and thank the germ-free mice now for a moment, because germ-free mice actually have really contributed a lot, including, I think, their lives for this, but they've actually taught us a lot about the microbiome, because they don't have a microbiome intentionally, or very much microbiome. So one thing we've learned from germ-free mice is that when we don't have a well-developed microbiome, we have impaired development of the enteric nervous system. So there's a drop in nerve density and internodal ganglia and even glia in the nervous system of the gut. And actually that impairs motility and electrophysiologic function of the gut. So, that may be also why, let's say, when people use certain probiotics, it helps their motility. In addition, what we know, and this I find fascinating, I just want to spend a few slides on, is that with germ-free mice, they actually get abnormal myelination of their brain. There's increased blood-brain barrier permeability, impaired memory, so they don't actually develop their hippocampi well, which is very important for long-term memory. And it even affects the size of their amygdala. So it actually, will affect the set point for the hypothalamic pituitary axis in the brain. And that's very important for stress response. So it happens in a critical window. So if at a certain point they don't have a microbiome, it'll affect it for life, or a well-developed microbiome. In addition, what we know is that the microbiome is very important for the function and maturation of brain microglia, which are actually macrophages in the brain. And those are very important, because they, again, help balance inflammation in the brain. Not too much, not too little. If they're dysregulated, they can start to secrete more inflammatory cytokines, which then can actually damage neurons. And they're also, interestingly, important for brain development in general and synaptic pruning and remodeling. So I just want to take a moment and talk about neuroinflammation. Neuroinflammation is kind of a hot topic in research right now. And basically what it refers to, this term, is low-grade chronic inflammation of the central nervous system. So it's actually being researched, as I said, it's a hot topic in mental health and cognitive decline, because it's thought maybe actually depression may be an inflammatory issue, not just what we think of as a neurotransmitter issue. The rationale for that is that inflammatory cytokines actually affect signaling pathways in the brain and can actually affect the generation of neurotransmitters. Alzheimer's, in that case, inflammatory cytokines actually stimulate amyloid production in the brain, and with the combination of oxidative damage can actually lead to impaired nerve function. With Parkinson's, inflammatory cytokines contribute to oxidative damage. And I actually talked about this. I did a grand rounds, I believe, on intermittent fasting in the spring, and I go through some of the physiology of that again with Parkinson's. But basically, inflammatory cytokines contribute to oxidative damage and lead to alpha-synuclein deposits, which we know are, that's thought to be the pathophysiology of Parkinson's, where they accumulate in these Lewy bodies, right? And then lead to cell death. So that's the proposed mechanism of action in terms of background. So how does the microbiome possibly relate to neuroinflammation? Well, one discussion a lot in research studies is that the microbiome, again, maintains tight junction integrity of the GI tract. We've talked about that a fair amount now. So when you have imbalanced microbiome, which we call dysbiosis, there's abnormal tight junctions and can lead to what's called intestinal permeability, leading to chronic low-grade translocation of bacterial endotoxins, including lipopolysaccharide, into the bloodstream. And we all know that lipopolysaccharide is related to, for example, cytokine storm with sepsis. So the idea is that this low-grade chronic translocation of LPS into our bloodstream from an underdeveloped microbiome can lead to low-grade chronic inflammation. And with that, then we're going to get an increase in depression and possibly neurocognitive decline factors, at least. So in exploration of that, there are studies showing that, for example, with Alzheimer's, they have 3 times the level of LPS in their blood versus controls. So, and LPS actually stimulates microglia to produce cytokines, which then stimulate amyloid production. So there's this, pathophysiologic mechanism here that's been looked at. In addition, with depression, LPS is actually used to clinically cause depression in animals. And, I remember when I was in residency, we were all taught never to sort of diagnose major depressive disorder if somebody has a major illness, because the inflammation can, all of the things they're going through with the illness can actually cause it to mimic depression. So I think clinically this makes sense as well, but it needs to be explored further. This is still not in the level of double-blind randomized control trials, which honestly will be hard to do because with the microbiome, it's such a complex topic. This is another study on Parkinson's. So again, as background, alpha-synuclein aggregates in Lewy bodies are the pathophysiology of Parkinson's. And interestingly, those Lewy bodies are not just found in the central nervous system. They're actually found in the enteric nervous system as well, which may explain why one of the early, for all of us in clinic, one of the early symptoms of Parkinson's is actually constipation, idiopathic constipation. Right. So in those Lewy bodies are actually, people will biopsy and find them in the esophagus and the colon, et cetera. So what they found in this study is they took patients with early Parkinson's and they found increased intestinal permeability. Probably they related that to the imbalanced microbiome they found. And they also found an increase in LPS secretion into the blood with that. They also found increased alpha-synuclein on biopsy of their GI tract. So this is in patients. And what I found fascinating is actually, if you look at animal models, so certain bacteria secrete alpha-synuclein in the gut, certain E. coli. And what they've done in animal models is they've radio labeled that. And it actually, the alpha-synuclein travels up the vagus nerve to the dorsal motor nucleus in animals. And so that's exactly where, Parkinson's is thought to originate from. So it's fascinating. Again, this is a pilot study. We can't prove cause and effect, but these are just interesting associations that I just wanted to bring to your attention. So again, interesting associations. It does improve cause and effect, but what I was trying to illustrate here is there may be, and there probably is, a gut-brain connection that we're still in the midst of understanding, but not just gut-brain, gut nervous system, because it also affects the enteric nervous system. Another last piece I want to talk about with microbiome and your health is that, from a mechanism of action standpoint, is this study which looked at 30 different medications that we prescribed. And as it turns out, the microbiome is very important for the metabolism of drugs. So the microbiome actually affected the activity and the clearance of all these medications. So although we often think about, let's say, factors like age and sex being important for the metabolism of drugs, of medications, the authors here, based on their study, say that individual variation of gut microbiota contributes to the differences towards drug therapy, including drug-induced toxicity and efficacy. So our microbiome may be a very important place that's actually determining how we actually process our medications. This brings up another point I get a lot from patients is, well, okay, I took antibiotics. How long is it going to affect me? What do I do? So these two studies start to explore that fact. The first study at the top, basically they gave people one of 5 different antibiotics and they just gave it for 5 days. And most people returned to their baseline with some altered. So it's an altered baseline. It's not a full baseline. Some altered taxa returned by 2 months. Some people, though, interestingly, did not return even by 6 months, which is as long as the study went for. And the researchers comment that their microbiome was similar to an ICU patient on multiple antibiotics, meaning they had much more drug-resistant organisms in their intestine, much less diversity, et cetera. So for some people, even a 5-day course of antibiotics can dramatically affect their microbiome for a long time. And I wonder, the authors didn't go into this, but I wonder if some of that influence is, again, I spend my time talking a lot about lifestyle changes and lifestyle interventions, but how they're eating and how they're, what they're eating, as we know, can make a huge difference in, that restoration of diversity. In addition, they took patients on multiple antibiotics. So I was just speaking with a resident yesterday who's rotating with me, and she treats a lot of people for H. pylori. I sort of think about that with our triple or quadruple therapy. But in this other study where they gave multiple antibiotics, it took 8 to 31 months to return to baseline. And again, some taxa remained altered. So same point with this. And so with clinical studies, the majority of better quality studies are actually on probiotics, because as I was sharing, it's really hard to study the microbiome as a whole. It's kind of like studying a forest. So I know in medicine, we really value double-blind randomized control trials, but it's very hard to do that, of course, with the microbiome. So now I want to go through some of that with probiotics, which are specific types of healthy commensal bacteria that we can do that for. So let's start with atopic eczema. So if a woman and so basically in this first study, which is a meta-analysis of 7 double-blind randomized control trials, they took women who were breastfeeding and pregnant. And if the mom took probiotics, it dropped the rate of eczema by about 10%. You can see that in both the double-blind randomized control trial and the meta-analysis. You're seeing a drop in the incidence of eczema in the child of about 10%. If the child takes the probiotic, it prevents the severity and the amount of eczema postnatally. And you can see this by this double-blind randomized control trial with about 400 infants. And they basically got lactobacillus for 2 years, and it dropped it by 50%. And this is fairly consistent. So it's actually fairly impressive, when you think about such a benign intervention, how effective it could be. My favorite part about this study is that they checked these infants 2 years after the study ended, and they'd stopped probiotics, and it still made a difference. So doing those probiotics in that, those first 2 years actually made a difference even when they stopped 4 years later. This actually is looking at probiotics and the prevention of atopic disease in general, so allergies, asthma, and eczema. And here they used in both these studies in the Lancet, Lactobacillus rhamnosus, which has the most data on it. So again, what we see in the first study is when the lactobacillus was given prenatally and for 6 months postnatally, it dropped the incidence by 50%. So these are mother-infant pairs. So both the infant and the mom got it. In the 2003 study, again, they just gave it to the infants, again, a drop in the incidence of 57%. So it's fairly consistent when we're giving these infants some probiotic that it actually potentially can make a difference. And what we see again in this last Lancet study is even when the probiotic stopped at 2 years, the results still continued at 4 years. Bacterial vaginosis, which I mentioned briefly before, just as background, we all know in primary care that, we can cure it with metronidazole, but then there's a 50% recurrence rate. So it's kind of frustrating because women keep coming back, right? And you kind of want to find something that would actually help them to really heal from it. And so based on these studies, you see a meta-analysis with about 2,000 patients, a randomized control trial. With recurrent BV, they use metronidazole for 7 days. And basically what they found is doing probiotics actually helps to drop the recurrence rate by 39% and 49%. So most studies that I looked at actually use vaginal lactobacilli. Oral may still be effective, but in my practice, I usually recommend vaginal lactobacilli. And I just want to point out that, with the menstruation, you're going to get a alkalinization of the vagina, which we really want an acidic pH for the vagina. So I usually do recommend doing the probiotic, especially with recurrent VV, during menstruation. And if they don't want to do it, vaginally, they can do it orally, but I do recommend that because of the change in the pH. Probiotics. So for respiratory infections, interestingly, so this study from the Cochrane database, and then another one, so one in 2015 and one in 2011, looked at meta-analyses of 12 randomized control trials with 3,720 patients. And it was found to drop the number of acute respiratory infections and also help with shorter duration and less antibiotic use. And in this second review, it dropped the odds of 3 or more acute respiratory infections by 43%. We also see this, I didn't put these studies in, but you also see this in kids in daycare, that if they get probiotics, say in their milk or whatever they're eating, that it'll also drop not only acute respiratory infections, but also norovirus and other GI tract symptoms, which we know kids in daycare are always getting sick, right? Anyone with kids knows. So H. pylori eradication. So there's a meta-analysis from 2017 with 20,000 patients. And they had, so the two options were antibiotic, our standard antibiotic regimen, or antibiotic with probiotic. And it improved the rate of eradication 84% versus 70%. So about a 14% improvement. And also what I want to point out is patients had less adverse effects of the antibiotic, because those can, cause a lot of nausea and diarrhea, especially with triple or quadruple therapy. And so I just want to point out that in both studies, we're seeing an improvement in adverse effects and an improvement in eradication. And now this brings up a question also I get a lot from patients is, can I take the probiotic with my antibiotic? Yes, you can, based on this. This is exactly what they did. If you take the probiotic for longer than just 10 days and you do for a couple months, that would probably be better based on some of the other studies I was sharing with you about how long it takes for the microbiome to recover as well, right? So probiotics and depression, this comes back to, well, our whole question of, well, does the microbiome affect depression, and is neuroinflammation a possibility with this? There was a meta-analysis of 19 double-blind randomized control trials with about 2,000 patients, and probiotics were helpful for depression if they were actually diagnosed with major depressive disorder. It didn't, if somebody's already healthy, it didn't really make a difference, but if they had depression, it did make a difference. And the combination probiotic was more effective than a single strain. I haven't seen it to be effective for anxiety in studies. There was one study I looked at, but it was sort of mediocre. And what I will say, though, is when I look at the studies, they are heterogeneous studies. So I think this still needs to be explored more, but it's interesting and pretty benign, right, in terms of an intervention. C. difficile prevention, I think the data on this is much more clear. So we see here two well-done meta-analyses, one of 18 randomized control trials with 6,850 patients, and another with almost 10,000 patients by the Cochrane database. And what we see is that if the person's baseline risk of C. difficile is about 5% or more, that it drops the rate of the odds of C. difficile infection by 65% and 70%, which is very significant, right? So this, I think the data is more clear on. Saccharomyces boulardii is, again, a probiotic I get asked a lot of questions about from patients. Even yesterday I did. And it's basically a non-pathogenic yeast. It's not actually like bacteria, but it's also been shown to be effective for prevention recurrence, and it's really stable. So in supplements and stuff, it's really stable. So that's always helpful. I just want to take a moment and talk about this guidelines from the American College of Gastroenterology in 2020. In this guideline that I read, they suggest against probiotics for global IBS symptoms. And they cite as their backup for this comment is that they cite this study that I put here. If you add, which I did, I actually went to that study and read the study. And here's what the authors write. Particular combinations of probiotics appeared to have beneficial effects on global IBS symptoms and abdominal pain, but it was not possible to draw definitive conclusions about their efficacy. What I would argue, and I just had not long ago a patient who was hospitalized for anticholinergic toxicity with actually IBS treatment medication. I would argue that probiotics are extremely safe and are worth trying for a patient who has global IBS symptoms, because if the risk is much lower than most medications, and likely if it does help your patient, you're going to get a lot of bang for your buck there. So I just want to put that out there, and I want to explain why I'm saying that and what the logic was. And I leave it to you to, of course, make your decision. Ulcerative colitis. So basically, it's interesting if somebody, so this study was a meta-analysis of 10 randomized control trials with approximately 700 patients. And what they showed is that people who did probiotics, if they were in an active flare, they actually had an improvement of remission about 47%. If they weren't in an active flare, that's that second study in 2020, that meta-analysis basically showed us that if they're not in an active flare, you can get an improvement of remission about 20%, but it's much more striking, let's call it, if they're in an active flare. So the best data on this is for a combination product with bifidobacteria. Side effects of probiotics. So it's very, very well tolerated. Probiotics are very well tolerated. The most common side effect is bloating, and I usually warn patients about that and tell them it can last a few weeks and then usually resolves. It is possible to have sepsis. Particularly, these case reports are if somebody has like a central venous catheter in, they're severely ill, they have febrile neutropenia, something like that, where they're fairly at risk. Okay, estimates of probiotics in foods. So again, I get this question a lot from patients, like, well, what foods can I eat that have probiotics in them? So the top one you can see that sort of leads the list is kefir. Kefir is like liquid yogurt, and I put that at the top picture there. You can see it in the container, and that has 25 billion CFU per cup. Then, as a sort of a distant second, we have yogurt, which is 3 billion CFU per cup. What I often tell patients is that yogurt is beneficial for probiotics. What often happens, though, in studies is that within 3 days of being on the shelf, the natural yogurt bacteria will kick out the probiotics that they kind of add in there. So, so you may actually end up with less probiotics than what's actually, so they infuse it with probiotics and you have the yogurt bacteria, but the yogurt bacteria usually kick them out within a few days. So if you can do fresh yogurt, it's better. Kimchi, which is fermented vegetables, sauerkraut, kombucha, and all these are fermented foods. They do have probiotics, and they're kind of listed in order of descending amounts. So another question that comes up is, well, are probiotics enough? And in my opinion, taking a probiotic is really a drop in the bucket without changing your diet. A lot of like, again, I talk a lot about lifestyle change in the practice here because we do integrative medicine, which is all about behavioral and lifestyle change. But the reason it's a drop in the bucket is because you can only legally, the government will only allow you to put very few species in a supplement because those would have been studied and as safe. And they're generally recognized as safe. That's why they're allowed to be in a supplement. They have GRAS status, which means that generally recognized as safe. But as we've just talked about, the human microbiome has many more species than are ever going to be found in a supplement. So in a sense, a probiotic is like a placeholder, which creates an environment which allows for other beneficial species to grow, but it's really not the end all be all. The most important thing is, again, comes back to our diet. And also probably how our environment, because in our highly sanitized lifestyle, I'm not saying to not be clean either, but it's true that our environment does affect things. So a plant-based diet has been shown to promote increased diversity of our intestine. And what we get from plants are basically something called prebiotics. Prebiotics are poorly digested by humans, but they basically are fertilizer for the bacteria in the gut, just like human milk oligosaccharides. That's an example we were talking about with breast milk, right? FODMAP, which we always tell people to eliminate, as a trial for irritable bowel, actually, all of those are prebiotics. So that's why, we're not, we all know this, but we're not such a fan of like trying to extremely restrict FODMAPs for infinite amount of time. There's a protocol for reintroducing those foods because we're going to severely limit our microbiome if we, avoid all prebiotics, right? Or FODMAPs. So increasing it back to the amount that they can tolerate. And I spend a lot of time helping patients do that and work with them on that. So all those things are going to help promote diversity and enrich the microbiome. So let's talk a moment about fiber. There are two kinds of fiber in foods. One is insoluble and one soluble. So the way I explain it to patients usually is insoluble is like sawdust. If you stick it in water, it just floats on top and doesn't really mix in, right? And so wheat bran is a really good example of that. A lot of patients will tell me, oh, I'm eating, whole grain wheat, which is good, okay? But the wheat bran is not a soluble fiber, it's insoluble. So it acts like a scrub brush in the intestine, but soluble fiber has a lot more data on it for some of these benefits that I've just shared with you. What is soluble fiber? Soluble fiber just means that when you stick that in water, it turns into pudding or gel. So the classic examples, the two main grains that have soluble fiber are oats and barley. Because think about it, oats turns into pudding, so does barley, right? But a lot of grains really don't have a lot of soluble fiber. So even though people, like, again, with patients, when I'm talking, they often think of fiber as grains. It's much more than grains, and many grains have a lot of insoluble, but not as much soluble. So oats and barley have soluble. Legumes have a lot of soluble, again, because you can see that gel. Chia and flaxseed are seeds that have it, and a lot of vegetables do. So many vegetables do, vegetables and fruits. So soluble fiber is when I was talking about butyrate and a lot of the other health benefits of fiber. So these we know, but dropping cholesterol, helping feed the microbiome, helping butyrate production, actually with detoxification of, so helping with enterohepatic circulation and not recirculating hormone byproducts, medication byproducts, et cetera. Soluble fiber is really what we're talking about. And that's why for cholesterol, we always tell people we use, Metamucil helps with cholesterol, right? So in summary, the microbiome is likely important for many aspects of health. We're still early in the research. And like I was sharing, it is hard to study this because it's not very conducive to our usual model of double-blind randomized control trials, because it's really looking at it as a whole versus looking at individual bacteria that hasn't, it's very hard to sort of like looking at the health of a forest. You can look at individual plants, but it's not easy to do. And it may not really reflect what's going on as a whole. So this is a little bit of a difference in our thinking. I just want to point out 1/3 of the metabolic products in our blood are actually from our microbiome. So, a lot of what we're exposed to actually is influenced by this microbiome. So it's clearly important. And we know it's clearly important for immune regulation. Probiotics specifically, which are commensal bacteria, may be beneficial for some issues such as atopic disease, bacterial vaginosis, C. difficile, irritable bowel, possibly, ulcerative colitis, and respiratory illness. They're not a substitute for diet change or diet improvement. And soluble fiber, I wonder, and the goal may be closer, based on ancestral diets, at least closer to 60 grams per day versus 25 to 35, which is what our US government currently sets it at. Thank you. So wonderful to be here. Thanks for your time.
Thanks, Astrid. Appreciate it. Astrid and I are in the same, I'm going to fix my gallery here. Astrid and I are in the same cafe program. I'm going to tell you right now, Astrid, you're picking the next restaurant that we're going to.
It might be a little too stringent.
I know. I don't know if we'll get Kasab to agree, but we're going. Okay. There's a comment by Dr. Pujari that he said that there's a nice article in the Benaroya Research Institute News demonstrating that a specific bacteria in the gut biome is likely cause of rheumatoid arthritis. That's Dr. Buckner's study, apparently. Send in questions. I have some while we're waiting for some to come in. I've asked you this before, Astrid. The probiotic issue, you know, all our patients want to take a pill rather than do it naturally. And the probiotic industry is real confusing because I know you've told me before, there are some that are good and some that aren't as good. Can you tell us how you do that? If people want to take a pill, what is a product? And how do we find the product in the health food stores or in the grocery stores that we can recommend to them?
Am I allowed to mention specific products now?
You
or
can.
not?
I'm going to say yes because I asked you that question.
All right, because I just wanted to be respectful of that.
That's fine.
I will start by just acknowledging the point about the rheumatoid arthritis and the microbiome. I'm fascinated by this. Actually, I've read so much on it, and I just want to acknowledge what they said because actually, if you do oral DNA swabs, so there's this whole interest now in the oral microbiome. And there's certain, so there's bacteria, it's got such a long name, I can't say it. It's called AA. And actually people who have periodontal disease with colonization of these 4 sort of pathogenic bacteria, particularly AA, there's actually also an association with rheumatoid arthritis. So remember that the microbiome is also really important, and soluble fiber also helps our oral microbiome. So periodontal disease is, 49% of the US population. And so these changes we've talked about also help your oral microbiome, which, just to their point about rheumatoid arthritis, there's some associations there that I'm interested in following. So I'd love to read that article that they mentioned. And I just want to say thank you. For the probiotics, so the one that, let's say for ulcerative colitis or that's been studied more, let's say, used to be called VSL number 3. And if you look up on the studies, you're going to see VSL number 3, V as in Victor, SL. The problem is that then there was a legal battle between, I believe, the owners, and please don't quote me on this, in the thing for this company. And so one owner got the name and the other owner got the actual bacteria. So the new name, so if you look at studies, you'll see VSL number 3. But if you actually are looking for that exact combo, it's called Visbiome. V as in Victor, I, S as in Sam, BIOME. Visbiome. So if you're looking for, let's say, ulcerative colitis, irritable bowel, different things like that, VSL number 3 has been looked at. Another brand that's been studied quite a bit, let's say for traveler's diarrhea, which I didn't even go into, is quite stable, is Culturelle, which is really a lactobacillus species. But as I shared with you, I'm more interested in combination for generally because, and VSL's got a combination with a fair amount of bifidobacteria. The reason is, so Culturelle travels well, and that's nice. But as I shared with you, bifidobacteria are a marker for health over our age. So, so it helps offset some of those increase in Clostridia and stuff that happen in the microbiome. So those are 2 that actually have data on them. And then another resource that you can look at is for very inexpensive, for a reasonable, I don't know the exact cost now, but I have a subscription and I don't remember how much it is. Consumerlab.com is a great resource for people who want to just check, like, hey, does this have what it says it does in it? And they have a good review on probiotics as well that you could look at. And it talks about cost, talks about efficacy. So it'll review the data. Is that answering your question?
Yes.
Okay.
There's a question from Dr. Gluck. He says, besides fiber-rich food, should we be encouraging kids to play in the dirt in less hygienic environments?
I think so.
Okay.
But okay, I will say that they did studies. So, okay, if this happens early, but like I go to India a fair amount, and what they've done is also studies like, okay, as an adult, if you do that, like it's actually we can't handle it. because our microbiome's now set a certain way. So doing it young is good. And then also, traveling and all that actually is good for us because it does enrich our microbiome and expose us to within reason, right? Within reason. So what I'm fascinated by with this is like, then you kind of think, well, what's infection? Is infection really just all about the bacteria? Is it also about the host? Because we have all these, bacteria and fungi and viruses that we're living with on a daily basis. So I think that's a really good point.
Astrid, could you just briefly, somebody didn't know what FODMAP, what you were talking about. Could you just briefly explain that?
Oh, okay. Fructans, oligosaccharides, they're basically components of foods such as in dairy, such as in apples, such as in wheat, that are fermented by bacteria in the gut. And they are thought to create visceral hypersensitivity with that fermentation in irritable bowel. So one of the things, let's say in GI or in primary care, which we will do is sort of put them on a diet which restricts those components. And we'll do it for a period of time. As I've shared, sometimes though patients end up like I get referrals. Like I had somebody who was doing that type of diet for, I don't know, like 2 or 3 years. And so we had to work pretty hard, to undo some of that, because if it goes on too long, it's really not good for microbiome diversity or their health, So
So
there's
it's
a balance.
diet. It's a restrictive diet that's used.
Yeah.
There was one anecdotal evidence of somebody who immigrated from Southeast Asia and confirms your Southeast Asia study of people moving to the U.S. There is also a question about whether a bowel prep for colonoscopy, does that affect the gut microbiome? And
Yeah, it does.
Get around it.
It does. And what I usually tell people is to use a probiotic for about 2 months after.
Okay.
Yeah, because you're basically washing away a lot of the, components.
Christine Pineda-Lou, another one of our cafe partners, she asks for recurrent bacterial vaginosis. She likes to recommend intravaginal lactobacillus crispatus, but patients have a hard time locating Physioflor. What product do you advise for patients with this issue?
There's one, Christina, called Biome. So I'll spell it for you. It's B as in Bob, I as in Igloo, O, M as in Mary, E. So I just want to sort of fill out Dr. Pineda-Lou's point, which is really well taken. Remember that premenopausally, estrogen in the vagina helps the epithelial cells of the vagina to make glycogen. And that glycogen then is eaten by lactobacillus. And so then the lactobacillus are the predominant, her point being well taken, that lactobacillus are the predominant bacteria in the vagina. And what they do is they create an acidic pH, which then kills other bacteria. Reason why people get recurrent BV, especially postmenopausally, is because with the estrogen drop, the vaginal epithelial cells won't make as much glycogen, and then the lactobacillus aren't, it's harder to feed them, so they don't stay. So her point being, so that's why doing intravaginal lactobacillus, especially crispatus is one of the ones that's been studied, can really be helpful. It's not the only one, but it's very helpful. So you can do it as a vaginal suppository. I usually tell them to do it at night the way we would vaginal estrogen. Excuse me. And Biome is a good one that they can buy easily, like online. They can just order it.
In the depression study that you presented, there was a little line in it that said it didn't prove to be effective in healthy patients that didn't have depression. Oftentimes when we get talks like this, everybody heads out and starts taking probiotics when they really feel fine. Is there evidence in healthy population that's eating a good diet and they feel fine that probiotics are helpful, or is it really for people that have specific issues with their microbiome?
It's more epidemiologic studies, Bruce, at that point. So, there are studies that correlate, like eating fermented foods correlates with better health, but it won't they're epidemiologic studies. So again, at that level, we're talking about, we can't prove, like, it's not a double-blind randomized control trials. And that I have to say I struggled in this talk, because a lot of what we're talking about here, because it's this holistic view, the microbiome is really a holistic view, which is really different than our reductionist model that we usually use in Western medicine. It was hard to do this talk because it's hard to find, you can't do double-blind randomized control trials on an entire microbiome. It's so hard to do. So your point is well taken. Really, there we're doing epidemiologic studies correlating fermented foods with better health. It won't be that doing a probiotic. And like I said, probiotics are really a drop in the bucket if we're not having that diet. To your point.
So I just want to let you know there's a lot of thank yous in the chat too. I know you're not watching. We've had an unprecedented use. I mean, probably 1,000% increased use of sanitizer over the last 3 years. I mean, just unprecedented. Has there been any studies that have looked at that with regards to the microbiome or how it affected it, or anything coming up? It may be too soon, but there's no question that I've used, I never used sanitizer before, a little bit, you know, and when I'm working, but I didn't have it at home. I didn't have it in my car. I didn't have it like we use it every time we shake somebody's hand now. And so have there been any studies that have shown that's effect on the microbiome or any effects at all?
I'm not aware of them yet, but it would be really neat to see. And that doesn't mean there aren't studies, right? Because there's always things that I'm learning and don't know. So.
Well, thank you very much. We're just a minute over time. We had close to 100 people watching, and obviously we'll do this more, and you and I are going to talk about the other talk you're going to give after the first of the year too. So thank you everybody for coming, and we'll see you next week. Thanks, Dr. Pujari.
Yes. Awesome. Thanks for being here, Mary. It really helps.